to our community of practice today. I'll just pass it up to you, Eduardo, to get us started.
Sure. Thank you. Good afternoon, everybody. My name is Eduardo Ortiz, and I work at the IDRPP, Institute for Disability Research Policy and Practice at Utah State University. And together with my colleague, Mindy Dokos, who is in charge of all the technical and logistic coordination, I would like to welcome all of you to another community of practice organized by the Multicultural Disability Network and Training, MultiNet project, that seeks better understanding of people with disability from multicultural backgrounds. The intersectionality of disability and diversity and diverse factors such as race, ethnicity, age, geography, like rural frontier settings, gender and gender identification, socioeconomic status, including health literacy and family situation, among other cultural elements that create complex contexts that needs expanded conversations and learning opportunities such as this community of practice activity. As part of MultiNet work, we have developed other products. I invite you to look at the link placed in the chat that is going to be in the chat box. Let me put it there. Okay. Today, we have the privilege to have Diana Ortiz, who works for Option for Independence as Independent Living Coordinator for North Cache County and Benefit Specialist, who will present about language barriers in accessing social services, considerations for systemic improvement. Diana is originally from Mexico. She and her family immigrated to the United States in 2001. Diana attended Utah State University and graduated with a bachelor in social work in 2011. Her primary work experience has been providing direct services to the community of people with disabilities, including the Spanish-speaking community in Cache County. She loves direct improvement. She loves direct practice, as being in the trenches helps her witness firsthand the need for policy improvement to bridge gaps in services to the people she helps. She decided to present to professionals in this network to share the successes and frustrations that she has experienced when providing direct services to people with disabilities, particularly those part of the Spanish-speaking community. Particularly those part of the Spanish-speaking community, and offer possible solutions to these barriers. I would like to talk about some ground rules and reminders as well. First, I would like to invite the audience to introduce ourselves briefly in the chat so we could know a little bit about you, including your name, your organization that you represent, and your role. Please keep your mic mute during the presentations. Remember that this community of practice group is here to discuss, not to debate or argue. Also, any discussion should be focused and avoid side-deviated conversations. Keep an open mind and be open to learning something new. Be respectful for others. I'm sorry, somebody wants to talk with me. Be respectful of others. Listening is as important as talking, and avoiding making assumptions. Lastly, ask questions politely is always appreciated to gain understanding and clarity. So join us for an engaging conversation about the intersection of disability and diverse communities and how it applies to helping professionals. I also remind you that this community of practice is recorded. Diana, the stage is yours.
Thank you so much, Eduardo. I was telling Eduardo and Mindy that I was going to begin the presentation in Spanish and just go at it, just start talking in Spanish and then see if anybody would understand. And I do see some names that look like they may have some Hispanic heritage in them. And so I was like, oh, okay, maybe they will understand. And I won't throw so many people off. But like Eduardo said, I am Diana Ortiz, but my full name, and I love to share that, is Diana Guadalupe Ortiz Tovar. Can everybody see my screen? Everybody can see, okay. Diana Guadalupe Ortiz Tovar. And that name has significance in the sense that I was telling Eduardo that my dad really fought for the name Diana, because in my mom's family, out of all her sisters, and she has a lot of them, they all somehow have the name Maria in there, right? And it's a very common name in the Spanish-speaking community to have a Maria or other names like that. And my dad was like, no, I want my daughter to have a different name. And nothing against that name. It's a beautiful name, and most of my aunties have that name in there. But my dad has always been a little like, let's play against the rules or let's go against tradition. And so that's why he wanted to name me differently. But my grandma was like, she needs to be named Guadalupe because that's my father's name. And it was just funny, like this tug of war that my dad had with my grandma. But I love my name. And in Mexico, we carry our mother's maiden name as well. So I have Ortovar at the end of my name because that's my mother's maiden name. And so that's, I love my name. I love that it represents kind of where I come from. And I don't always get to use it fully, but I thought for this presentation in particular, I could, and I did. My family and I immigrated here when I was 14 years old, and I didn't speak any English at all. And I would say that my very first accomplishment, if I would say, was when I learned English in high school. So I started to attend what back then was called the English as a Second Language program in my high school. And I started with that program, and I graduated in the English AP program, which I was really proud of. And that was kind of like the first accomplishment that I had coming to this country, is learning the language. But not everybody gets to, and it's hard. Not everybody can or always has the resources to do that. And that's kind of why I wanted to talk a little bit about that. I work with the Spanish-speaking community. Most of my work experience has been with this community of people with disabilities in this area of the country, obviously. But I believe that what I'm experiencing here could apply to people just about anywhere, in Utah or other places. But let me start with a quote. And Nelson Mandela, in his autobiography, Long Walk to Freedom, he said the following: "We were not different people with separate languages. We were one people with different tongues." I'm not gonna go into what he could have meant by this quote in this moment, but I would like you as the audience to think about this, to think about what he could have meant by that quote. And maybe at the end of the presentation, we can either you can type in the chat what you think he meant, or after I go through this presentation, you can raise your hand or ask to speak and tell us what he could have meant by that. And again, based on my experience working with this community, I feel passionate about making especially social services more accessible to them. And that's, again, I just kind of want you to think about the quote throughout the presentation and think about what it could mean. And then we're gonna go to the next one. Some statistics for you. So I don't want to just say, oh, we all have to provide services in Spanish, but the population of Spanish speakers is growing in the country. And I broke it down from the United States all the way to here in Cache County. So as of July 21st, 2022, the United States, the Hispanic population, which means the Spanish-speaking population, constitutes the largest racial or ethnic minority in the United States, which is 19.1% of the population. In Utah itself, in the 2020 U.S. Census Bureau, the U.S. Census, 15.1% of the Utah population identified as Hispanic or Latino. Here in Cache County, where I reside, 15,076 people identified as being Hispanic or Latino, again, in that 2020 census. And from the Utah language report that was revised in 2024, but Spanish ranks as the second language, that second top language spoken in Utah. in every county and in every health district, except in San Juan County, where Navajo is the second most spoken language. And then in going back to disabilities, 9.5% of people with disabilities in Utah are Hispanic or Latino. So again, this is people are out there that need our services and that speak Spanish, and maybe that's one of the main language they speak. Their language proficiency may be limited. My practice experience comes from, again, 10 years of working with this population, this community in particular. And I'm gonna give very general examples. I am not gonna identify people or identify agencies. I'm not here to tell one agency, you could do this better, or we all can improve. I know here where I work, as I prepare the presentation, I thought about, oh my goodness, we could do better with our website. We could do better with our phone system, you know, when those of us who speak Spanish are not in the office and things like that. Successes, again, it's the opposite of the frustrations that I face. So when I talk about successes, you will see that it's basically the opposite of what I've been witnessing with my frustrations. And recommendations, I believe that, you know, we can talk about problems all day long, but what can we do about it, right? Like, I hope that we can, at the end, I can provide a few recommendations that could improve agencies' capacity to provide accessibility to those they are serving, especially if are individuals who speak a different language than English. So, so let's see, yeah, this one. So I do have a few more statistics, and this is related again to in research that what I have seen, it kind of corroborates the research behind it. And so as you can see from this slide, I'm not gonna read everything to you, but the Kaiser Family Foundation, or KFF, and the LA Times got together and did this, a nationally representative sample of immigrants in the United States to kind of learn more about their experience here. And in this survey, in this study, they learned that 53% of this group, they have a hard time speaking English, obviously, and it's in doing that and having limited English proficiency has made it really difficult for them to get access to healthcare or apply for government benefits, as well as communicate with their children's school. I was just talking to my sister about this recently. She worked as a liaison for in a school district, well, in a particular school. And she said that prior to her being hired or working there, she saw a lot of parents. Anyways, when she was hired and working there, a lot of parents would come to her and be like, "Oh, you speak Spanish? Oh, thank goodness," you know. And then they would just go up and tell her their story. And how they really wanted to communicate with the teacher and they couldn't, or like, or they just felt like the teachers weren't understanding what they wanted for their kids and blah, blah, blah. And so she was telling me a little bit about that and her experience working as a liaison between parents and faculty at the school that she worked for. But the ADA network, which is the Americans with Disabilities Act National Network, also corroborated some of that stuff that I'm seeing in my practice. Where people with disabilities continue to be underrepresented in their ability to access education or healthcare, employment, and some of the additional barriers that they face is related to language and lack of access to information, etc. So let me now go into more the things that I witness firsthand, or that I have experienced with some of my consumers. And we call them consumers, and that's how they choose to be called in the area that I practice, independent living, which disabilities, is they want to be called consumers. But you might have patients, you might have clients, you know, that you serve. But phone calls, just last Friday, I got one of my consumers. They called me and they said, "Tiana, could you help me make an appointment with to see the doctor?" And I said, yeah, I can do that. And the reason why they called me is because they had to call this clinic where they have not been able to get through, like make that phone call themselves, because it's hard to get somebody that can communicate with them there. So obviously my consumer only speaks Spanish. And they said, can you help me make this appointment? So I gathered, obviously I already know birthday and all of that, but I said, why do you need to see the doctor for? And, he said, because of this. And I said, okay, I'll call. And sometimes I make these phone calls on my own, or sometimes they're here with me. But in this case, they live pretty far away from that clinic. So I said, well, I don't want you to come in here into my office to make the call, so I can do it for you with your permission. And I don't even know if that's right sometimes, but I was just like, they need the help, so I'll do it. So I called the clinic, and this is what I experienced. The phone rings, and they have a Spanish option. So they say, para español, presione el número dos. So I purposely do that, even though I speak English, because I want to see how the rest of the call goes. So I press the option 2 for Spanish, and an automated system, the automated system continues. And it says, thanks for waiting. And then that is translated to gracias por esperar. Somebody will be with you as soon as possible. Again, it's translated, alguien estará con usted pronto, lo más pronto posible, blah, blah, blah. And then it goes into announcing a lot of things that, just things that they have to remind their patients about. But the rest of it is not translated at all. And so I'm like, okay, that's okay. I can just wait here. And then finally I comes through, I get through, and I get a person that speaks English. So, and again, this is not the first time that this happens. It happens a lot as I help consumers call agencies, whether they be government agencies, sometimes whether they be just a hospital, a clinic, or whether it be another social service agency in the area. And I go, hi, I'm trying to help a Spanish-speaking consumer set up an appointment to see the doctor. Is there any way I can get somebody that speaks Spanish? And they're like, oh, yeah. You know what? Let me see if I can transfer you to the front desk and they can help you. And it looks like I reached some type of, I don't know if it was like a call center that I reached or something for this particular clinic somewhere else. But they're like, yeah, let me transfer you to that particular clinic. And I'm sure they have somebody that can talk to you in Spanish, or that can talk to the person that you need in Spanish. So I waited, and they transfer me. And again, I get a very nice lady on the other line, but it's also in English. So I talked to the lady. I said, I have this person, they only speak Spanish, and they really need to schedule an appointment with the doctor. Could I do that with you? And they go, yeah, of course you can do that. So I provide the information, we schedule the appointment. And I say to this lady at the end, I said, I am not able to attend this appointment with this person, with this consumer of mine. I said, will you have somebody there to help with that, with the medical appointment? And she goes, yes, we will have we have an interpreter line, and we can do a video call. I'm like, wonderful, that's amazing. And I also said, this particular person, and again, my consumers give me permission to disclose this information. Otherwise I wouldn't disclose it. But I said, my particular consumer, I said, they have a very, very, very limited literacy. I said, so even though the forms might be in Spanish, and I hope they are, they're like, oh yeah, we have the forms in Spanish. I wonder if there's a way for them to just like have somebody guide them through it, or so they know kind of what they're signing. And they're like, yeah, we can make sure, and somebody maybe helps them with that. And I said, okay, thank you so much. And so I hang up, and then I call my consumer back, and I said, hey, the appointment is set for this day at this time, kind of like what works for your schedule best. Because oftentimes they have to take work off, and it's hard because depending on their situation, some jobs aren't very good at giving them a day off to go to the doctor, or they get upset. Their bosses get upset, and they tell me these things. They're like, I don't want my boss to get upset because I asked permission on this day to take my daughter to the dentist or something like that. And I'm like, okay, so we'll make it work as best as possible with your schedule. So again, in this particular scenario, it is wonderful that the clinic had a Spanish, an option for Spanish. What was hard is that even after the option, you still have these, the fact you still end up with someone that doesn't speak Spanish. And so if you have the option, how come it doesn't smoothly transition to that option, right? And this is not a one case scenario, one type of scenario. I mean, this happens a lot as I call just places. There's an agency, a federal agency actually here in Utah that I call a lot to help both English speaker consumers and Spanish speaking consumers, apply for their services. And that this particular federal agency does not even have a Spanish option. So when you call, everything is in English from start to the end of, and I know if you go into their office, they will provide an interpreter. I have gone into their office in person with my consumers. And if we say we need somebody that speaks Spanish, they will provide somebody that speaks Spanish, right? But it's the phone call that I'm kind of, that I find myself confused by, that that option is not there, even though they're a federal agency. So I'm like, okay, that's something. Websites, I know even here at Options, we can improve on our website accessibility. So websites, most of the time, they don't even have an option to change the language of the website. It's just, everything is in English, right? And another thing that I notice when I go on websites too, to try and help them apply for benefits, is that if the message might be, if you need any of this in another language, please, let us know and call this number. But the message itself is in English. So I'm like, how is somebody that doesn't speak English going to understand this message, that they can have access to an interpreter or a different, these documents available in a different language? We do that, let's say, in disabilities, like if somebody is blind, we say, this information can be provided to you in Braille, or if somebody has some limited vision, or like depending on the visual disability they have, we say, this can be provided to you in large print. So, but when it comes to language, we don't often have that. Or again, in this case with websites, a lot of the things that I run into is this just little tiny piece of, they don't have the option for Spanish. Or if the option is there, is in English, like Spanish, click here. And I'm like, why doesn't it say español, aplique, presione aquí? And so I'm like, it's just this confusing thing that I run into with my consumers and myself, right? Because I'm trying to access these websites for them and with them. I'm gonna do paperwork first and then customer service. Paperwork, again, going back to my consumer and his situation with a lot of the people that I serve have limited English proficiency, but also limited literacy. Their literacy skills are very basic oftentimes. Like I have a lot of the people that I work with who, due to their circumstances in their native country and coming here later, over there, they couldn't really get a formal education. My mother, she has a second grade level of education in Mexico, where she was born and raised. And so she doesn't write very well, even in Spanish, and she can read fairly well for the most part, but a lot of times she doesn't read the words correctly. And so I imagine and we often go with her to appointments. So like, I'll go with her, we set up appointments with her. We do all of that. And when we were little and we first immigrated here, we would do that even as kids, right? We go to these agencies and to apply for something, or even just we go to the store to buy groceries. And here's like this 10-year-old translating for mom, everything, right? And it's just an interesting experience. Looking back, I didn't mind it. I wasn't 10 years old, I was 14. But I'm saying a lot of my consumers sometimes take their kids, right, to do the interpreting for them, the translation and things like that. And I don't know if that's right. It doesn't quite sit well with me sometimes. And I know the kids want to, at least I wanted to help my mom, and I still do. And we still help her a lot to access services of any kind, even just especially medical things. But paperwork itself sometimes is not quite set up. And again, this is a top-bottom situation. It's not something that we can start wherever we are, but paperwork is often not written in ways that can be accessible to people with very limited literacy skills. So what I was explaining earlier is that, not to you guys, to Mindy, was that, let's say that I go with my consumer and they are filling out an application for food or and we use all this jargon in our professions, right? That we understand. And even if it's translated into a different language, it's still a lot of jargon. And so I have to think of the content and the context. I have to be like, okay, let's say that I'm explaining like that somebody has to sign something related to HIPAA. I just go, hey, this is a law, and they have very limited literacy. I just go, this is a law in this country that tells you that your information, your health information needs to be protected by law. I said, so not everybody can access it. Not everybody can just, request it, so this is what you're signing. So I try to break it down to very simple things that can be understood by the person that I'm with. And the more I help this community, the more I realize how I have oftentimes also used language myself that they are confused by. And so again, just being aware of those things in our paperwork. Something that I noticed too, a lot of agencies don't translate their flyers or even their, let's say there's a new program that the agency is trying to reach to put out in the community and say, hey, we have this new program in our agency and we want to make sure that people know about it. But the flyer is only in English, let's say. And so I'm like, oh, can I get that in Spanish too? Because I get a lot of people that come through my door that speak Spanish, and I want to make sure that I put the flyer in my office or in our main lobby area that is in English, but also the Spanish, so that they can know what that is about. So we get that a lot, that people just kind of create the flyer, but we often don't think that what other populations we're serving. And again, that can be adapted to depending on the area that you are. Maybe like when I was talking, depending on the area that you live or that you work at, that it may be a different language that is more needed there than Spanish in this case. But that's something that I noticed. Customer service, this is where it gets a little tricky for me and it gets hard. And again, this is just what my consumers are telling me, and some of the things that I have experienced myself. But they say, we go in and if there's no one that can communicate with us in our language, they just kind of just say sorry, can't help you or something along those lines, and we have to leave because they can't communicate with us. Or those are not as hard as when they say, well, we went in, but the lady seemed upset that I needed help. Or the person seemed upset, and they rolled their eyes, or they just kind of had an angry face the whole time, and they were, and then I just felt really bad for going in the first place and trying to get help. And so I'm just like, oh, that's not good, and again, people aren't doing this all the time. We all have bad days in our work, and so it's not like we're always going to greet everybody with a smile and say, let me help you right now. But again, these are very general things that I'm saying, but this is very consumer after consumer has shared some of these concerns with me. And again, the phone calls in particular, I always get to experience them because I'm always calling with them different places, and that's very, very, very common. That phone calls they just don't have a smooth transition, or again, not even the option to help them in a different language. Let me go to the next. Success is the opposite of what I just said. The opposite is that when we make that phone call, things just kind of are smooth from start to beginning. And in my work, working with people with disabilities, I really push for people to do their calls themselves, it's all about helping people with disabilities be as independent as possible. And we push and we say, if you're able to fill out this piece of paperwork, we want you to fill it out. If you're able to make this phone call, we want you to make this phone call. If you're able to do this, we want you to do it. So we really push for independence. But in my particular case with these consumers, I can't push for independence in some of these things because though they have the capacity to pick up the phone and dial the number, they will still not be able to communicate with the person on the other side of the line. So then I have to be that person in between. But obviously, we have had some wonderful experiences too, where if they provide the Spanish option, they definitely get a Spanish person on the other side of the line, right? Or I want to say this experience that we had recently. We went to this agency, and the moment we walked in, the lady was just like, "Hey, how can I help you?" And I was just like, "Well, they're here, for this particular thing." And they go, "Oh, that's wonderful. Let me see if I can find somebody for you that can assist you." And they found somebody, and they, things just ran really smoothly from then on. And I let my consumers take charge from then on. I just kind of sit back and let them do it themselves. If there's someone that can communicate with them in the language that they need, again, mostly for me, Spanish. But paperwork, I have an agency here that is doing this a lot, in this area, that now every time I get something from them that they're trying to advertise, I get it in both Spanish and English, and I love it. And so I am that chair right now for the Cashier Agency Council here in the area. So we have these meetings once a month, where I meet with many of the nonprofit agencies here in the Valley, and I send an email every Friday to kind of let them know what's going on with what services or events or things are happening in the community that they need support in. And so we as a network know how to support each other, or what events are coming up that we can promote in our network, promote with the people we serve. But this particular agency, they're always sending me their announcements in both English and Spanish, and it's the best. And I love that when they do that. But customer service, again, is the opposite. People just feel, oh, I gotta tell you this part. So a lot of my consumers, what they say, that the best part of when they go to some agencies where they don't have somebody that speaks Spanish, is that the person helping them still tries. So they say, they pull out their phone, and then they were typing things on the phone, and then they would show me the screen, and I would read it, and I said, oh yeah, and then they were back and forth. So they're like using their computer, their phone, Google Translate. They're just using any means to communicate with this person, with my consumer. And they come, and they're like, they were so nice. They were trying to help me, even though I couldn't talk to them. We were able to type things up where I was able to write my message, and then they use the computer to put it in the computer and try to translate what I was saying. And so I think the biggest thing that they say is they tried, and they were really nice, and they were really kind to me about that. And so, a few recommendations in terms of what I've been seeing again this past 10 years, and it's improving. And I don't always have to be the liaison in a lot of these things, but if your agency has the capacity, funds or not, the way I was hired here at Options is that my boss wrote a grant. She saw the need that we were getting a lot more Spanish speakers through the door, and she's like, we don't have anyone that speaks Spanish in our office. So how do I get somebody here? So she first needed the funds, so she wrote a grant to be able to get that, to be able to hire me. And that was in 2010, a long time ago. But that was back in 2010. And she's like, we needed that. So she kind of found the funds to hire a full-time employee. And in my first title, my job title was Minority Outreach Independent Living Coordinator. So I was supposed to go out there in Cache Valley, in this area, and find the Spanish speakers of people with disabilities, the Spanish-speaking people who had disabilities. And so I went out there, and I figured it out one day at a time, and I was able to bring a lot of people that needed our services, not just the ones that were coming through the door, but the ones that probably didn't even know that we could provide those services. So it's kind of like, if you have a way to provide interpreter services, you don't even have to have the money to hire, let's say, somebody that speaks Spanish. I know a lot of places just have they have an interpreter line, so they have a language access line. And I know that sometimes, I believe that if people have a health insurance, sometimes their insurance will provide an interpreter for them. Again, so I have heard about the Tarjimli app. That's a free app, and it's run by volunteers, and it's available for nonprofit organizations to use if they need access to a translator or an interpreter for somebody that's, let's say, walking through the door or something like that. Google Translate, it seems like a really simple thing, but most of the positive experiences that my consumers have shared with me about when they go to agencies or places and try to access services is that people got through Google Translate out and try to communicate with them. So it's such a simple thing, but it makes a difference to the people receiving the service. Translate documents. Again, we all can do better at that. Even here at Options, we don't have everything that we do translated into a second language or anything like that. But we do have our main flyer in both English and Spanish. We are lucky to have a lot of Spanish-speaking people in this agency. But we also have, I have this thing called, this was provided to me, it's called an I Speak card, language identification cards. And they have various languages there. This one was provided to me by a different organization, but they have like, oh my goodness, probably 1, 2, 3, 4, they have a lot of languages here. So this website that I put at the bottom is lep.gov. It's language, it stands for limited English proficiency.gov. It is a government website, and it has resources for organizations to like print out those language identification cards. You can print out and have at your reception desk, just in case somebody comes through that doesn't speak English, that they can identify the language they speak on there. And they also have tips on how to make your website more accessible to individuals with limited English proficiency. I mean, it's a really good website if you wanted to get help on how to translate documents and things of that nature. And then again, automated systems, I cannot emphasize that enough. My one experience that I share, it's one of hundreds. I face that a lot with automated phone systems. People are using their neighbor, are using their kid, are using their caseworker. They're trying to get to you, to talk to these agencies, because even the automated phone system is not quite like able to do what it says it's going to do, right? And so we run into that a lot. I run into that a lot every single week. Call one agency or another, government or otherwise, hospital, clinic, anything like that, and they just even if the option is provided, it still doesn't show that it is provided. I mean, in the end, I still have to be doing the interpreting for my consumer, even though it said that they could talk to somebody on the other line that spoke their language. And so, but again, going back to this bottom part right here, not every agency will have the ability to implement everything. There's no way. Some of us obviously are very small. The agency that I work for, there are 15 total employees. We have a little satellite office in Brigham City, but here at Options, here in this main office, we have 13 of us. And so we run on a considerably small budget. So we may not be able to do everything perfectly, but we try. And not every agency will be able to do everything, but we can start by doing something, especially if your agency has those automated in place. It's automated system that provides a Spanish or a different language option. Try to see if we can improve the way that call is routed, right? So that it actually does what it says it will do. And I think in terms of translating documents, I know some places, I mean, this website can help at lep.gov. I know that some places just use Google Translate, and then if they have a Spanish-speaking employee or staff there, they just make sure that they go over what Google translated and kind of correct some things that were translated. So it doesn't have to be this huge undertaking. I know in the beginning I would translate documents a lot, and that, like our application, I translated it and things like that. And I translated the flyer back in 2011, I think, as well, for our agency. I think that it's better to work smarter, not harder sometimes. I'm like, now looking back, I'm like, oh, I don't know if Google Translate would have done that back then, but probably it would have. It could have helped me a lot, and I would just have fixed the things that were incorrect. But anyways, again, going back to the positive experience that my consumers have had in all these agencies that they go, it's just that people really try. So they show kindness, and they show that they really care about providing the service that they are there for. And so try to communicate with them in one way or another. and they really always in this community always talks to each other. Like that's the thing about it. Like they will say, oh, they really helped me here. And it's not about the fact that they had somebody that spoke Spanish. I think just the fact that they still figure out a way to communicate with them and get through and provide the service that they needed. And so again, seems like such a simple thing, but going probably back to the quote that I shared at the very beginning with Nelson Mandela, when he says we were not different people with separate languages, we were one people with different tongues. I'm curious to know what, after just listening to some of this that I presented on, what do you think I mean by that? Or what do you think Nelson Mandela meant by that when he said that in the context of what we're talking about today, this language barrier that a lot of people that we serve are facing? Bertha Gillen or Gillen?
Hi, yeah, I'm Berta Guillen. I am a research assistant at the University of Kansas. And my role is a little bit of a community liaison, connecting families with resources. So this was a great chat. For me, the quote, it really just brings it down to we are all human despite of the language that you speak.
Yes.
Because I do see a lot of minority health, right? So we're all human and we all deserve to be treated with dignity and respect.
Yes, thank you so much, Bertha. And again, I think going back to that dignity piece, I wish I could go back and I don't know. I guess when I think about my mom, when we were younger and we always had to translate everything for her, as we started to learn the language, and the reasons why people don't learn English. Like I had the privilege of going to school and got to learn a lot of that. But my parents had to work really hard to provide. And by the end of the shift, they were just tired and done. And going to an English class wasn't as doable. They had to still be there for us. And so, but my dad does speak some English now, but my mom still doesn't quite do that. And so the reasons why people don't learn the language oftentimes are many. But yeah, I think that if I could give my consumers that dignity to just make the calls themselves and know that they can do it on their own, and they don't always have to have somebody looking over their shoulder at appointments, or they're appreciative. They're so appreciative of that. But I know that some of them would just like to do it on their own. Beatriz Frometa?
Yes, see. I think what he means is we are only one community. We are only the human race. That's it. Doesn't matter what color, or you are short, tall, big, small. Doesn't matter what it is. But I think the tongues is because they give us the salt and pepper in this world. We need to have something else to get involved with another communities. Communities, I'm talking different countries, different languages, different ideas, different customs. That means I think he was a really nice quote, because they describe the human race in this world.
Yeah. Thank you so much, Beatriz.
Welcome.
Anyone else has an idea of or anyone else has experienced that as you're helping individuals that speak different languages? Or I have helped some individuals in the refugee community here in Cache County. Cache Valley is a resettlement area now, and so we do get some individuals who are refugees, and I actually have used Google Translate to communicate with a few people that I have helped. Because one time I used my language identification card, and that language that she spoke was not there at all. So then I had her I had her write it down. I don't even know how I did it. I was just I don't even remember, but she wrote the language down. And then I started to go on Google Translate, and I started to put, how can I help you? And then so you do the best you can. And that was an interesting experience for me. It wasn't Spanish. It was a whole different language. It was from Africa, this language that this person spoke. But I still tried, and I still helped as best I could. So anyone else has experienced those things maybe out when helping the community? Have any of you noticed that as well when you call other agencies, or even like anything like that? You can unmute yourself if you.
Hi,
Oh,
it's
Berta, yeah.
yes, I have my question. So I'll be honest, I'm relatively new to the field of the social services. I come from the
Oh,
private
mhm.
sector,
Okay.
but I am a mother with a child with a disability. My
Yes.
first language is Spanish. So I've in this new role, like you said, I was the first bilingual hire. I'm the one that's having to translate the flyers, the initial, points of contact.
Mm-hmm.
But the challenge I think here lies with management and upper
Mhm.
levels, because sometimes they say they want to support, but but there is no tangible steps towards that.
Yes.
So, and sometimes I think that they might even have some like cultural blindness or just, I know they mean well. I know their heart is in the right place, but sometimes even some, I don't know if they don't have the awareness or of that it's a lot more complex than just translating a flyer.
Yes. Yes. Thank you, Berta, for that comment. Yes, like I said, I was very lucky in my agency that my boss saw the need and she decided to write the grant and get somebody here. And if whatever I suggest to her, usually she's really willing to do. But I think when it comes to some of these fixes have to come from way on top. Like when I mentioned that federal agency, I'm not gonna name what federal agency that was, but when I mentioned that federal agency that I call all the time, and I've been trying to think how to do this the proper way and say, hey, like, I know that if we come to your office and we make that drive and we meet here with you, you're amazing and you provide this, if I come with somebody that doesn't speak English, you'll provide somebody that speaks the language of the person that I'm coming with. But if my consumers are trying to make a phone call, they cannot even they can't. They have to have me be there to make this phone call. And so sometimes, and it's in the law. I think one of the slides says that it's part of the law that any agency receiving federal funds is required to provide language access unless it provides an undue burden to the agency, right? Again, if you're a very small agency and you somehow don't have that way to do that, and it's really going to be really expensive to provide an access line, I'm sure you can justify, I'm sorry, we don't have the funds. But if there's a way for, I don't know, it's supposed to be provided. My consumers are not the type to complain and be like, hey, this agency is not making accessible their services to me, let me sue you. They're not doing that. They're so kind and they just want somebody on the other side to just be as kind to them as I guess they are. And so like they're not doing that, but it is in the law that we have to provide if we are receiving federal funds. So maybe some administration could be made aware of that. It's like, hey, this is a law that we need to abide by. Yeah, Maria Gutierrez.
Hello, my name is Maria Gutierrez and I'm in Alabama. And I want to share with all of you, I am the family navigator for the Regional Autism Network. So we work with families that have individuals, on the spectrum. And we do have a large population of families that move from areas where they speak an indigenous language.
Oh.
And sometimes, that is very difficult to find a qualified interpreter.
Mm-hmm.
And as a professional, I also feel that sometimes we need to take and remove our own biases because many times we wonder, well, why don't they learn, our language? Why don't they learn Spanish, right? Well, I don't speak any other language except English. And, and English is a second language to me. So my primary language is Spanish. But I think that as community, we need to really respect, people that speak indigenous languages because they are the keepers of their own heritage, right? These people are trying to preserve, the knowledge embedded within their own language. And, this is passed through generations. So we need to value, that they are here and that they are trying to preserve this, this information, this that is being passed through their ancestors. And some of these people later on, what I have seen is that they take like important roles within that community. They take leadership roles. So as agencies, we need to do whatever we can to ensure that we could provide adequate language access. And for us should be viewed as a privilege. And I feel very honored when I have those encounters because I learn from those families. And it takes humility from us.
Yeah. Thank you so much, Maria. And for example, in San Juan County, like I said, San Juan County here in Utah, Navajo is the second most spoken language in Utah in that area of the country. So I would say advocate for flyers to be translated into Navajo, right? Or like for if people whose native tongue is Navajo are calling in, make sure that maybe there's an interpreter for them if they really want to be able to access that service, which many of them probably already speak English, but I know some of my friends who are Navajo who I've met, for example, their grandma, they wouldn't speak English. She only spoke Navajo, and she experienced the same thing as I did, like that she would have to help out with things like that. And so like translating and things of that nature. Katie Cox.
Hello, thanks for this presentation. I've really appreciated it. I was just going to mention something that I've noticed sort of along these same lines that I felt like for me was a really important lesson that when I'm working with folks, particularly refugees who have come seeking asylum and have perhaps experienced political or religious persecution, and then we're using interpreter services sometimes, particularly I think in person is a little easier to gauge what is happening, but when we're using like phone interpreter service, sometimes the client will feel really unsafe or need to establish some degree of trust with the interpreter to know that they're sort of safe to talk to because of what they've experienced in their home country. And so, and there are sort of signals or triggers that mean certain things in that specific population, words or phrases or questions to be asked or answered that I wouldn't otherwise be aware of in a particular culture or community. And that's been a really important thing for me to learn and to recognize a level of comfort or discomfort from my client to be talking about. I'm an attorney, and so confidential information that's really really core to who they are and if they feel safe enough to share those things. So that's just something that I've been learning to sort of an additional layer when being culturally competent.
And there are, thank you for bringing that up, Katie. Yes, that's an additional layer right there. You're having to share this very sensitive information. Now they're not only sharing it with you as the professional, kind of trying to help them, but then some person that they don't even see or they have not built a relationship of trust with at all, but they still have to share that in order for you to be able to help them, right? So that works. And so again, intersectionality, I didn't use that word really much today, but you can see that through Katie's example. You can see that through just knowing that if our services are not if people that we serve, the different demographics that we serve, the different people that we serve cannot even access our services because they're not available they're not accessible to them in a language that they can understand at a literacy level that it's a little bit more appropriate for their circumstance. And again, this is extremely hard. I'm not saying that we have to revamp everything, but that's why I said this system needs to be improved from the top bottom. I mean, it's not something that we're gonna fix today, and it may take many years before we can see some of these improvements made. But it can start locally where we are. It can start our very agency, and if we have any power to talk to those who are in a position to make some of these improvements for again, those people that are coming through our doors or that are calling our phone number, that they are able to get through to us, that they're able to, and again, some of my consumers who go to other places, they're not saying, I want somebody to speak Spanish. They're saying, I want somebody that is willing to help me, right? And so and they do, like again, you get on an app, and they find a way. So I don't know. I hope that made sense. I hope this is helpful. If anything, maybe we can start by making sure that our announcements about new services that we are advertising on our digital boards or on our actual resource board that we have. I know we have here a bunch of flyers that we have from the agencies from all over that can, it's like, hey, we have it not only in this language, but in this other language, or again, those language cards at the front office that in case somebody comes through, they don't speak English, but they speak, I don't know, Tagalog or or they speak Burmese or whatnot. Like they can still, we can find a way to help them and not make them feel like, well, no, sorry, no English, we can't help you, right? No Spanish or no whatever it is language that they speak. So that's it that I have. My contact information, it's in the back. I got all of the research and things that I told you about from these sources. I didn't just make them up. That's where they are. And that's my contact information. If anybody wants to reach out about anything, I'm more than willing to help in any way I can. Eduardo.
Thank you so much, Diana. How rich is this conversation, and we can start, talking for much more time. But yeah, time is a big limitation that we have. Many questions, actually, I was prepared to ask you, but I hope that I'm gonna follow up later on during those community of practice. There is one question in the chat that is saying if we can share your PowerPoint with the audience. So, Diana, if that's okay, we can share with people who is requesting that. Thank you very much for reminding us those demographics. This nation is becoming more and more diverse. I always mention the 2012 was the first year that the majority of newborn babies were coming from diverse population. And now the majority of the children are coming from diverse populations. So we don't need to wait until 2030 or 2050 when the majority of the population is going to be from diverse population. Right now, diversity is an important factor in our nation. And if we add the complexity of disabilities, we need those conversations, we need those discussions to understand better each other. So, Diana, it has been a privilege to have this presentation from you and to share your knowledge, your experience. I do really appreciate. And there are some questions there that we would like to get some answers from you that is helping us to organize a future community of practices as well. There are additional products that I said that this project has prepared, and I invite you to look at the website that we have and get connected with us. We will be very happy to expand additional conversations about those intersectionalities. Mindy, I don't know if you have any additional comment before we are ending. Again, very thankful with the conversation of today.
Thank you so much.
Diana, I agree. Thank you so much for being here. Thank you for your message. Thank you everyone who has participated today, shared your thoughts as well in the chat, and unmuting yourself and joining in. This was such a cool meeting to be a part of. So thank you all so much for your participation. I'm gonna post the link to our website one more time. We also have, if you haven't already received our newsletter, we do a monthly newsletter, and we will be sharing. We have another community of practice meeting coming up next month. It's going to be really great too. So watch for that in your inbox, and also it will be on our website soon. But it also went out in our newsletter. So if you got the newsletter yesterday, you already have access to register for that. It will be middle of next month. So exciting things. And yeah, like Eduardo said, please answer those that poll that I sent out to everyone. That helps us to make sure we're learning all together like we did today. So thank you so much. Yeah, I will put the link to our website in the chat. And I think that's everything for me. So thank you all very much for joining us today.